This is Medical Terminology, Headache and Dizziness Case Study, Dolores Gillum. Case presentation, male 54 years old, came in with dizziness, feeling like he is veering one side to another, having difficulty in keeping balance while walking, and is unable to ride a bicycle. Headache, mild diffusion, not throbbing. Ringing in right ear, tinnitus. History, diagnosed with migraines 10 years prior. Usually has aura before migraines, but did not this time. Sumatriptan did not help. No history of tinnitus or vertigo. Uncertain about hearing test. States wife and daughter says he cannot hear them as when he's speaking. Task 2. Analyze the medical terms. Tinnitus, origin, Latin, tinnitus means ringing, tingling in the ear. Migraine, origin, Greek, hemocrania, hemo, half, crania, skull, migraine. Means pain in the head. Vertigo means to spin or to turn. Task 2, analyzing medical terminology. No, I already did that. Task 3, common medical abbreviations. HEENT, ears, eyes, nose, and throat. BP is blood pressure. MRI, magnetic resonance imaging. If I could talk. Task 4, most likely diagnoses. Acoustic pneumoroma, right side, best explanation for the reasoning of progressive dizziness and imbalance, no hearing loss, which makes it less likely to be Meniere's. Task 5, significance of medical terminology. Question: why do you think a solid understanding of medical terminology is critical in healthcare setting, not only for effective communication among healthcare professionals, but also in upholding ethical standards of patient care? I think that a solid understanding of medical terminology is crucial because if you do not understand the jargon or of the medical field, then you will not be able to communicate effective with your peers. Also, this may result in lack of proper care for patients and miscommunication with your associates. Also, wrong communication or not proper communication can result into medical errors. Summary: 54-year-old male with progressive dizziness, tinnitus, and headache. Differential Meniere's vestibular neuritis, BPPV, acoustic neuroma, most likely acoustic neuroma, confirmed with MRI. Treatment depends on size, symptoms, observation, surgery, radiation. And that concludes my medical terminology.